Human Immunodeficiency Virus, HIV, and Prevention for a Healthy Life. Introduction to HIV. Human Immunodeficiency Virus, HIV, is a retrovirus that attacks the immune system, specifically the CD4 cells, T cells, which help the immune system fight off infections. Over time, HIV can destroy so many of these cells that the body can't fight off infections and diseases anymore. If left untreated, HIV can lead to the disease Acquired Immunodeficiency Syndrome, AIDS, a condition where the immune system is severely compromised, making the body vulnerable to opportunistic infections and certain cancers. Modes of transmission. HIV is primarily transmitted through the following modes. 1. Unprotected sexual contact. This is the most common mode of transmission. 2. Where the virus can be spread through vaginal, anal, or oral sex with an infected partner. 3. Sharing needles. Intravenous drug users who share needles are at high risk of transmitting HIV. 4. Mother-to-child transmission. HIV can be transmitted from an infected. 5. Mother to her child during childbirth or through breastfeeding. 6. Blood transfusions and organ transplants, although rare in developed countries due to rigorous screening. 7. HIV can be transmitted through infected blood or organs. 8. Occupational exposure. Healthcare workers might be at risk if they come into contact with infected blood or body fluids through accidental needle sticks or other exposures. 9. Unsterilized medical equipment. Reusing unsterilized needles or other medical equipment can 10. Lead to HIV transmission. Prevention strategies for a healthy life. Safe sex practices. 1. Condom use. Consistently and correctly using condoms during sexual 2. Activity can significantly reduce the risk of HIV transmission. 3. Pre-exposure prophylaxis, PrEP. This is a medication regimen taken 4. by HIV-negative individuals at high risk of contracting HIV to lower their chances of infection. 5. Limiting partners, reducing the number of sexual partners and having 6. Open discussions about sexual health and history with partners is important. Harm reduction for intravenous drug use. 1. Needle exchange programs. These programs provide sterile needles to drug users to reduce the risk of HIV transmission. 2. Substance abuse treatment. Getting help to overcome addiction reduces the 3. likelihood of sharing needles and engaging in risky behaviors. Prenatal and perinatal care. 1. Antiretroviral therapy, ART. Pregnant women living with HIV can take ART to prevent mother-to-child transmission. 2. Formula feeding. In settings where safe and clean water is available, formula feeding 3. is recommended over breastfeeding for HIV-positive mothers. Blood and organ safety. 1. Screening and testing. Rigorous screening of blood and organs for 2. HIV before transplantation is crucial to prevent transmission. 3. Safe injection practices. Healthcare facilities should follow strict guidelines. 4. For the use and disposal of needles and other equipment. Occupational safety. 1. Standard precautions. Healthcare workers should follow proper 2. Infection control measures, including wearing gloves, gowns. 3. And masks when handling potentially infectious materials. Education and awareness. 1. Promoting knowledge. Public education campaigns can raise awareness about 2. HIV transmission and prevention strategies. 3. Removing stigma. Reducing stigma associated with HIV can encourage people 4. to get tested and access treatment. Regular testing. 1. Knowing status. Regular HIV testing helps individuals know their status. 2. And seek appropriate medical care if needed. Living a healthy life while preventing HIV involves a combination of personal responsibility, safe practices, education, and access to healthcare resources. It's essential to stay informed about the latest developments in HIV prevention and treatment, and to make informed choices to protect yourself and others.